You might think that financial reasons are a big obstacle for patients not getting pregnant. Certainly that's true, but we know from studies that the #1 reason that patients stop fertility treatment before achieving their dream of a pregnancy is frustration. So if you've been with a general OBGYN and had treatment and diagnostic testing for some time and you feel your frustration level rising, it's time to see a fertility specialist. In general, female age greatly influences egg quantity and quality. So if you are getting older, and generally we feel that in women under 35, a year or more of trying to get pregnant is a reasonable amount of time before seeking fertility care. And if you're over 35, 6 months is a time to seek fertility care. So particularly as women get older, it's important to accelerate the speed at which they seek care with a fertility specialist rather than a general OBGYN. Many women these days certainly feel their biological clock ticking when it comes to starting a family. But this is an area that we continue to feel we need to get information out to the public and educate them on. As women get older, they have fewer eggs left, and the quality of those eggs, and what we mean by quality is genetic normality, goes down. So a higher and higher percentage of eggs that a woman has left as she gets older are genetically abnormal. And when those eggs ovulate in a given cycle, they either don't fertilize, or if they fertilize, they're often lost very early, miscarried very early, or don't implant. And that accounts for generally lower fertility as women get older. Because of this, because the number of good eggs is low as women get older, it's important as women get older to have prompt evaluation and treatment of their infertility. Clomid is an oral fertility medication that definitely has a role in fertility treatment in specific situations. Its role is in women who don't ovulate regularly on their own and in situations of unexplained infertility when it's combined with intrauterine insemination. But many studies have shown that after 3 or 4 treatment cycles of Clomid and intrauterine insemination, if a woman is not pregnant, the likelihood of Clomid working is low in the future. So after 3 or 4 cycles, that's also a time to consider seeing a fertility specialist. Many studies have shown that with male factor infertility, lower level fertility treatment is not very effective. So if the sperm count in general is less than 20 million per milliliter, or the motility is lower than 40 to 50%, most low-level fertility treatments don't work very well. And it's important in situations like that to promptly seek care with a fertility specialist, because most often in vitro fertilization with ICSI is the most effective treatment with a significant sperm factor. ICSI stands for intracytoplasmic sperm injection. And when the sperm count is very low or the sperm motility is very low, the sperm may not be able to fertilize an egg even when placed together with the eggs in a dish in the laboratory. So in those situations, a single sperm can be injected into an egg and accomplish fertilization. Things like endometriosis, prior tubal pregnancies, scar tissue, these are all factors that can affect the fallopian tubes, and most low-level fertility treatments are not very effective in treating tubal factors. So if a woman has severe endometriosis, has had prior surgery, has had multiple tubal pregnancies, this is a time that she should promptly see a fertility specialist to be given accurate statistics for a surgical treatment of these situations versus in vitro fertilization, which in general is far more effective. Very important to realize that you are in control of the process. It's your body and it's your future fertility, and you need to be an advocate for yourself. And if you're seeing a general OBGYN, and you feel that time is moving on and you're not getting your questions answered or getting appropriate testing done or treatment, then it's important to take control of the situation. Your future fertility is more important than your OBGYN's feelings, and they'll be happy to see you back pregnant if you go on to a fertility specialist and then come back to them once you're pregnant. The bottom line message I would say is that with modern fertility treatment, we can help many, many women get pregnant, and it's important to get prompt treatment and diagnostic testing. With prompt, appropriate treatment, fertility specialists can help many patients have that family that they have hoped for.